Alright, you guys, welcome back to another video lesson from ICU Advantage. This is going to be a special video that I've put together to really discuss this coronavirus that has been in the news here lately. Given the media attention and the climbing death toll of this virus, there's obviously a lot of questions out there about it and certainly some concern as well. In this lesson, though, we're going to take a good look at what this virus is, how it presents itself, how we treat these patients, and ultimately what this means for all of us, particularly as healthcare workers. And if you look out there, some people are really worried about this virus, while others are downplaying it and comparing the death toll to the thousands that have already been killed this year by flu alone. So really, who's right? So keep watching, and I'm going to break down all of the latest info so that you guys can be truly informed. Alright, and my name is Eddie Watson, and this is ICU Advantage. My goal here with ICU Advantage is to take these complex critical care subjects and really break them down and make them easy to understand for you guys. And I truly hope that I'm able to, and perhaps by the end of this lesson, I may have earned a subscription from you. If you do, make sure you hit that bell icon and select all notifications. That way you'll never miss out on a new lesson. Alright, so let's get in and start to talk about the coronavirus. And I really think this beginning picture really kind of sums this up. When I initially was playing around with Illustrator and creating this coronavirus, as sort of a joke, one of my friends on Facebook had made the comment saying it doesn't look mean enough. Hence, this is where I sort of made this quick little adaptation to it. But it really goes well with the question here on why so serious? What's the big deal with this coronavirus? So to really get a good understanding of what this virus is, we really need to talk about what is coronavirus. So really what we're talking about here when we hear this being talked about in the news is we're actually talking about something we call the 2019 novel coronavirus. And essentially what this means is that this is a new, never-before-seen virus that's a member of what we call the coronavirus family. Now, these coronaviruses can really cause illnesses ranging from the common cold to severe respiratory illness. Now, as a quick side note, we know when people are talking about the common cold that this is typically being caused by the rhinovirus. And obviously, when people are talking about the flu, we're talking about the influenza virus. So obviously, this is a different virus than those typical viruses that we're often talking about. So let's talk a little bit about the structure here. And to do that, let's actually take a look at what the coronavirus actually looks like when we're looking at it with an electron microscope. Now, the thing about this virus is it's incredibly tiny. In fact, it's less than 100 nanometers, which is why the only way that we can actually see this is to use a really powerful microscope such as electron microscope. But as far as the structure of this virus goes, is it's actually a single-strand RNA virus. Now, the virus does have this protein shell that goes around it. This is something that we call a capsid, and this is actually going to be really important a little bit later on when we talk about the transmission of this virus, but essentially this is going to allow it to survive for longer periods of time outside of a host body. Now, where this virus really gets its name from is these crown-like spikes that we see all over the outside of this capsid. And this is essentially where we get the name corona from this crown-like appearance. Now, all of these coronaviruses are actually something that we call zoonotic, which means that they're transmitted from animals to humans. Now, there are several known types of coronaviruses in animals that we've seen that don't actually infect humans. So it's actually pretty rare for them to infect people and to spread about amongst a human population. Now, when it comes to these ones that we found that can infect humans, that there's actually 7 coronaviruses that are capable of doing this. Now, of these 7, 4 are pretty common coronaviruses. And these ones generally just cause mild or moderate upper respiratory infections, similar to the common cold. They can, though, sometimes cause lower respiratory tract infections like bronchitis and pneumonia. Often, though, with these viruses, that these are short-lived and not severe. Now, after these 4, there are 3 not common coronaviruses that also infect humans. And in fact, up until last month, there were only 2 others. So these coronaviruses are known to cause severe symptoms. All of these are thought to have their origins in the bat population and have spread to other animals, which ultimately led to them transmitting to humans. So the first of these not common coronaviruses is something that we call the severe acute respiratory syndrome coronavirus. So this actually first came about infecting humans in 2002. And this one also originated in China, and it was believed to have come from interaction with some sort of wild cat. But here, over the course of just over a year, there were about 8,098 cases with 774 deaths. This essentially gave this about a 10% mortality rate. So 1 in 10 people who contracted this virus ultimately ended up dying from it. And so just to put it into context, if you remember back in 2002, there was a big scare about this. Here in the United States, they estimate about 165 probable cases. All right, so the next of these not common coronaviruses is something that we call the Middle East Respiratory Syndrome, or the MERS CoV. Now, this one actually came about in 2012, and it was initially reported in Saudi Arabia, and they believe it was actually a camel that initially spread this to humans. Now, we actually still do see a presence of this particular coronavirus, unlike SARS, which has gone away since 2004. And with the MERS coronavirus, we had a total of 2,298 lab-confirmed cases with 811 deaths. This essentially gives us a 35% mortality rate. So now, of these cases, we actually only had 2 cases that ended up being imported into the United States. But as you can see here, while we had less cases, we actually had a few more deaths, which ultimately gave us this very high mortality rate. So essentially every 3 to 4 people out of every 10 that contracted it ultimately ended up dying. And so then finally, for our third not common type here, if you haven't figured it out already, this is going to be the 2019 novel coronavirus. So hopefully that gives you guys a good understanding of what this virus is. So next, let's talk a little bit about the spread of this, and this is something that you're hearing referred to as a pandemic. So you probably have heard this term used, and you might be wondering, how is this any different from an epidemic? What is this terminology that's being used to talk about this? So when we're talking about the spread of disease, there's essentially 4 different levels that we categorize them. The first is something that we call sporadic, and this essentially means that we have an infrequent or irregular number of cases that we see. Next is what we refer to as endemic, and this means that there's a constant presence and a usual prevalence within a particular geographic area. Next is what we refer to as epidemic, and this is where we have a sudden increase in the number of cases for a particular area. And then finally is the word pandemic, and this means essentially that we have a worldwide outbreak over either several countries or several continents. So now when it comes to talking about the 2019 novel coronavirus, that the outbreak initially began in Wuhan, China in December of 2019. And they ultimately first notified the World Health Organization on December 31st. And so this is essentially the epicenter of the epidemic. Now here you can see this map of China. The star is Wuhan, which is where this all began. And this map here is basically showing the number of cases for each province of China, with the brighter red being the more numerous number of cases. And while they believe that this initially spread from animal to human, they now believe that it is human-to-human infection that is occurring. Now, obviously it's spread within China, but we have also seen the spread to multiple countries outside of China, which we'll see on this map here. And this is essentially where we get the pandemic from. Now, at least so far, with the exception of Thailand, every other country that has the cases of this particular coronavirus are in the single-digit numbers. But as you can see, it's spread to just about every continent, to include North America, Australia, Europe. Now, if we take a look at our US cases, we currently have 5 confirmed cases, with the most recent one being actually here in Arizona in Phoenix. Now, every single one of these cases, though, are actually cases of it being imported, so people who were previously in China, in or around Wuhan, brought the virus back, and we haven't had any human-to-human transmission within the United States. Now, the CDC does believe that this is a serious public health threat, but they do believe the risk to the American people is pretty low at this time. Now, overall, between China and the rest of the countries around the world, we've had about 4,500 cases. And of those cases, we've had 106 deaths reported. Now, obviously, because we're in the middle of this and really kind of trying to get a grasp on this, these numbers are constantly changing, and all of this information is up to date as of the 28th of January when I went out and collected this info. But as you can see here that this virus is less severe than SARS and significantly less than MERS. Because here we're looking at about a 3% mortality rate. So that's good news. Compared to some of these other coronaviruses, this one definitely appears to be weaker. But even still, the 3% mortality is pretty high compared to a lot of other viruses that we typically encounter, most notably being the flu, which generally has 0.1% for the mortality. And of the 5 cases that we have here in the United States, we have not had any deaths from this. All right, so let's go ahead and move on, and let's talk about the actual clinical presentation of this virus. So first, let's talk a little bit about the transmission. Now, we have hit on some of this already, but we know that we have transmission that can come from direct animal contact, and now we believe that we have the human-to-human transmission. Now, the way that it's spread is through droplets that come into contact with either a person's nasal cavity, mouth cavity, or their eyes. And so obviously coughing and sneezing is going to spread this, and it can really spread it out to 6 feet away. Now, from there, the virus can actually survive on surfaces. If you remember, we talked about that protein shell, and because of that, it actually can survive up to 5 days on various surfaces. And obviously, you're going to have a greater risk of transmission if you're in a closed environment. Now, when somebody does contract this virus, there is an incubation period, and we believe it to be between 2 to 14 days. So up to 2 weeks before a person begins to have symptoms of the virus. Now, unfortunately, it is believed to be contagious, though, during this period before a person is showing symptoms. So really, all of the preventative measures where you see them checking people's temperature, this ultimately could still allow somebody who's infected to slip past. All right, so let's talk about the symptoms that people are going to have with this virus. Now, unfortunately, with this particular virus, the symptoms that we're going to list out here are really going to mimic the flu, which, as we know, is currently full swing within the United States right now. Now, the numbers that I'm going to present here are coming from The Lancet with the first couple of studies that have just recently come out of China. Now, obviously, these are looking at a limited number of patients, but they're the only thing that we really have right now and is giving us the information that we need in terms of what we're seeing with this particular virus. So the first and most common symptom is fever, and about 98% of the patients with this virus presented with fever. Now, the next most common symptom was a cough, and we had about 76% of the patients that had this. Next was going to be dyspnea, or difficulty breathing, and we had 55% of the patients that ultimately ended up with this. Next most common was fatigue, with 44% of patients. And then finally, for the major symptoms, the next or least most common here is going to be sputum production. And here we had about 28% of the people that had this. There were some other symptoms reported, but those really came about in small numbers, and really focusing on these big symptoms are really the primary focus here. So as you can see, this looks a lot like what we're going to see with a patient who has the cold or has the flu. So it's potentially going to be difficult to identify. And we'll actually kind of talk about the ways that we do that here in just a minute. Now from here, as the illness progresses, that this ultimately can cause a severe lower respiratory infection, something that we call pneumonia. And essentially what this means now is we have an infection of alveolar lung tissue. And this is ultimately going to lead to fluid and purulent consolidations of the alveoli, which is ultimately going to prevent gas exchange, causing hypoxemia in our patients and potentially leading to hypoxia. Now, as this progresses, this can also lead to ARDS, or acute respiratory distress syndrome, and we did see 29% of the patients that ultimately developed this. Now here with ARDS, our patients are going to have this profound damage to these alveoli, causing additional fluid to leak into the alveoli, and leading to a worsening of our patient's hypoxemia. Now as things progressed for these patients, of all the patients that they looked at, 10% ultimately ended up intubated, and half of those ended up with refractory hypoxemia, ultimately leading them to ECMO. And so based on this data that's come out, let's take a quick look at the timeline from the onset of symptoms. Now on average, at about day 7 is when these patients had their hospital admission. On day 8 is where they began to have the dyspnea. On day 9 on average is where they developed ARDS. And on average on day 10 and a half, that this is where they were admitted to the intensive care if they got to that point. So as you can see, almost 2 full weeks from the onset of symptoms, and you can really see that this virus has a slow progression. All right, so let's go ahead and move on from here and talk quickly about how we diagnose these patients. Ultimately, we want to suspect patients who have a fever and/or symptoms of lower respiratory tract infection when the following criteria is met. First, if they've had recent travel to Wuhan, China in the past 14 days. Next, if they've had close contact, which the CDC describes as being within 6 feet of a person who has a known novel coronavirus infection, or if they've had exposure to a healthcare facility in which an infected person is being treated. And lastly, but most vague, would be any person who develops an unusual or unexpected deterioration of their condition despite the appropriate treatment. And this is really without regard to the place or origin or where their travel history was. And so obviously providers are going to have to use their judgment with this last one and really any of these and make a sound decision based on the evidence that they have. If we do suspect a person of interest, though, we need to immediately report this to the hospital infection prevention person as well as our state or local health department. They're the ones who are going to be responsible for alerting the CDC and moving things forward in that arena. Now, there is laboratory testing that can be done to confirm this infection, but currently that's only available at the CDC. So if we do have a person of interest, that we're going to need to collect samples in order to send them out to them. And there's primarily 3 samples that we need. We need one from the lower respiratory tract, the upper respiratory tract, and serum. Now, if possible, do collect a sample of stool and urine, but really we're going to hold on to that in the event that the CDC decides they need that. Now, in order to get this sample from the lower respiratory tract, we want to do a bronchoalveolar lavage and then a tracheal aspirate of that, or we want to collect their sputum. Now, in order to collect the upper respiratory tract sample, we want to do both a nasopharyngeal and an oropharyngeal swab, both of them together. And then the serum's pretty self-explanatory. Now, one last thing that is of note here is if we do check a CBC, our patients are going to exhibit a leukopenia or having the lowered leukocytes or the white blood cells. And this is where we found our WBCs to be less than 4, and this is about 25% of the patients. Now, in addition to that, when we look at the specific white blood cells, we're also going to notice a lymphocytopenia, or a reduction in the number of lymphocytes. And here it's going to be less than 1, and we actually saw this in 63% of the patients. Now, this lymphocytopenia is something that we often see after the flu, or in particular when we have these imported viral infections, so something to keep an eye out for. All right, so next let's talk about what we can do to treat these patients. Now, coronaviruses are notoriously hardy viruses. They hide really well from our immune system, and we don't really have any reliable vaccines or treatments for them. Now, this doesn't mean that vaccines are impossible, and in fact, China has actually pretty quickly gone and sequenced the genetic code of this particular virus. But because of the fact that we don't have a vaccine or really a reliable treatment, our primary treatment is really going to be revolving around symptom management. And these are going to be things like avoiding antipyretics, at least in adults, because we really want to have an increased temperature to facilitate our immune system. We obviously want to ensure that our patients are getting the hydration that they need. And then from there, a lot of this management is going to primarily revolve around the oxygen treatment for the patient's hypoxemia. Now, depending how this progresses and if they develop ARDS, that this may require intubation and mechanical ventilation, or possibly even VV ECMO. Again, here, the immune system is really going to be our primary treatment for these patients, and anything we can do to facilitate a proper functioning immune system is really going to be of benefit to them. Now, when it comes to antiviral treatment for coronavirus, we really haven't had anything that's been proven effective. But based on our past experience with these other coronaviruses, we have seen 2 antiviral protease inhibitors, medications called lopinavir and ritonavir, which were actually associated with pretty substantial clinical improvements when dealing with the SARS outbreak. In addition to that, we also have a broad-spectrum antiviral nucleotide prodrug medication called remdesivir, and this one showed some potential efficacy in treating not only SARS, but also the MERS coronavirus. Again, it's really too early to know if there's any truly effective treatment options when it comes to these antiviral medications. And again, our big focus is really going to be on the supportive therapy. All right, so lastly, let's go ahead and move on and talk about how we protect ourselves from this virus. So both the CDC and the World Health Organization have put out some guidelines regarding the best practices when it comes to caring for these patients. Being healthcare workers, this is really going to be important for us to know, because in the event that we come across one of these patients, we're going to want to ensure that we're doing the necessary things that we can to prevent the transmission to others, including ourselves. So we do have some guidelines for protection. All right, first is that we're going to want to initiate contact and droplet precautions with goggles and mask. We want to have these patients isolated in well-ventilated rooms, and we really only want to cohort if it's absolutely necessary, and if so, we're only going to do that with other suspected individuals. If possible, they really suggest that a team of healthcare workers should be designated to treat only these patients to reduce that risk of transmission. Now, important to know, though, is we did notice back with the SARS outbreak and the MERS outbreak that certain procedures are known to aerosolize the coronavirus. This is going to be things like intubation, non-invasive ventilation, CPR, manual ventilation with a bag valve mask, and bronchoscopy. If any of this is going to be happening with this patient, then this patient really belongs in a negative pressure room, and we should be using either the N95 or some sort of particulate respirator when we're in the room with the patient. And then from there, all the obvious normal things that we would be doing, standard precautions, good hand hygiene, all of this can go a really long way to help to prevent the transmission of this virus. All right, so overall, really the big takeaway with all this is that we want to ensure that we're really doing everything we can to prevent the spread of this and really contain this outbreak. And as I said, according to the CDC, right now our concerns for a bigger problem are really pretty low. Now, one thing I have seen, though, is a lot of people have really been comparing this to the flu virus, and I don't know if this is really a fair apples-to-apples comparison. While the intention certainly seems to be to marginalize the fear that some people have from this particular virus, the situation with these viruses are quite different. With the flu in the US alone, we have 10 million people that get the flu each year, and of that, we have 12,000 plus deaths each year. That is absolutely a lot, and it's certainly something that people need to be aware of. But what this does tell us, though, is the flu has about 0.1% mortality rate, so relatively pretty low. And a couple of the big things that really help us here is that we have a relatively effective vaccine that comes out each season, as well as we have effective medications to treat patients who are having symptoms of the flu. Now, these are two very important distinctions from the flu to the coronavirus that we're dealing with here. Now, again, obviously the numbers that we're talking about are pretty insignificant compared to the number of people who are infected with the flu just in the United States alone. But I think what people's biggest fear is if things were to become more transmissible and we started to see things spreading easier, which certainly has happened in the past, that we're obviously dealing with a much more deadly virus here. Now, again, if we do all the things that we can do, we know the CDC and the World Health Organization are doing everything they can to try and contain the outbreak. I really think that our fears and our concerns of this happening are going to be pretty low. And really, we can just focus on doing what's best for ourselves and the patients to help them if we do find ourselves caring for somebody with this. All right, you guys, I hope you enjoyed all this information. I really hope this gave you what you were looking for, gave you some more information about this virus, and ultimately what we're going to do to treat our patients who come across with this. If you haven't already, make sure and subscribe to the channel, leave me a like and a comment, let me know what you thought, and make sure and watch this awesome suggested video right here. Thank you guys so much for watching. You guys have a great day.